Hi guys, my name is Courtney Gauze and I am here to talk to you about my organizational assessment paper. I did my experience at Penn Medical Center at Princeton, that's in New Jersey. It was originally called Princeton Hospital and it was founded in 1919 from donations from a wealthy Princeton professor. Now it has been open for 100 years, but we still have a lot of the same principles that we had back in 1919. In 2018, Penn Medicine, which is located in Pennsylvania, partnered with Princeton Healthcare System to make it one of the leading academic medical centers in the United States. The new name of this hospital is the name of the hospital is Penn Medical Center at Princeton. Penn Medical Center does acute care, behavioral health, rehab, skilled nursing, home care, hospice, fitness, wellness. They also have a program that does all health education, screenings, other supportive services. Each unit is equipped with state-of-the-art technology to help their providers best serve the patients. Their mission statement is to provide exceptional, compassionate care to enhance the health and wellness of patients, families, and the community. Some of their values include communication, compassion, collaboration, excellence, and integrity. These values are why I chose to go to PCP. It is one The values line up with a lot of my values. It's also the reason that I chose to follow their director of nursing, Dolores Vandegrift. She was absolutely amazing. I stayed over 24 hours with her while doing this assignment, and I learned so much by being with her. One thing that I know is the same probably at every hospital in the United States is their communication. They use informal and formal communication. A lot of informal communication is while giving report to other nurses, especially if it's a patient that they've had on the unit for a while. They might just say, oh, Mr. So-and-so, nothing has really changed, or, these labs have come back. However, I did notice that while giving a report to a doctor or a member of the respiratory team or phlebotomy or anything like that, they did more to the point. They articulated, they had controlled conversation, they didn't deviate to other things, they didn't talk about other things, they just talked about that one patient. The budget I did kind of talk about with the director of nursing. She just said the budget was different before 2018 when Penn took over because they were really just getting their donations from donors. They didn't have a big company backing them. And I don't know if this is true where you guys are, but in New Jersey, a lot of these big hospitals, like the Children's Hospital of Philadelphia or Penn Medicine or Robert Wood Johnson, they are taking over these smaller hospitals and they're partnering with them. So I know that like another hospital in our area, we now have CHOP with them. So it's still called Virtua, and they have a lot of them in our area, but CHOP partnered with them, and that brings in a little bit more money. Patients, for whatever reason, feel better seeing a big name like Penn Medicine or CHOP on a hospital instead of just Princeton Hospital. So the budget really changed when Penn Medicine took over Princeton Hospital. As far as the financial department, you can put together a wish list, if you will, and the financial department will make sure that you get all the necessities, gowns, gloves, soap, things like that. And then whatever money's left over, they're going to try and make your wish list work. So they might do new computers, they might do updated equipment. The hospital also pays for all the scrubs for the nurses and other attire such as jackets with your name. The 5 steps of a risk management process are identifying the risk, analyzing the risk, evaluating the risk, treating the risk, and monitoring the risk. In a hospital, risk could be anything. It could be an attack on the hospital. It could be a breakout of anything. It could also be a money issue. So, Princeton Medical Center at Penn Medical Center at Princeton uses this to deal with whatever the risk is. So they identify the risk and then they go on to the other steps based on what exactly that risk is. A functional structure is a structure which includes undertakings like supervision, direction, management, allocation of responsibilities. Princeton uses the functional structure as their organizational structure. Communication was listed as one of the core values at Princeton. Using this, everyone from a med tech to a physician can state exactly what they need at Princeton. Each unit still has a manager taking care of the people on that unit, but the manager also has someone above them and someone above them and so on and so forth to help get these tasks going. Again, communication is a key to this structure, and that really is a key to everything in healthcare. A current trend that's really affecting Princeton is technology. So technology is a blessing and it is a curse. At Princeton, they use the most state-of-the-art machines. They have everything to diagnose and hopefully cure patients based on what is going on with them. They also have something called digital technology, which refers to technology that produces and uses electronic information communication, like a web portal. So patients can log on to their own patient web portal. They can look at their records. They can look at their labs, especially if the doctor called, but they completely forgot what the doctor said, because that has happened many a times. However, technology can also be a curse, and that is especially true at Princeton, mostly because of the cell phone. So a doctor can come in with a plan of treatment for a certain disease for a patient, and he believes that this is the best course of action, and then the patient and family member say, well, that's fine, but I googled what we should be doing, and based off of that, this is what I think that we should now be our step. And the doctor tells them, unlike Google, I took all of your factors into consideration, so I know exactly what has to be going on. So don't just Google something. Like, I looked at your demographics, your age, so something that worked for one patient necessarily isn't going to work for this patient, so Google is not the best thing. So like I said, technology is a blessing and it is also a curse. As you guys all know, there are 5 different nursing care delivery systems. Not all 5 were used at Princeton that I saw anyways. I did see a couple of different. So the first one was the total patient care system. That is when an RN assumes responsibilities for the whole group of patients and provides all the care to the patient. So they're the ones giving the bath, they're the ones informing, they're the ones talking to the doctor, they are doing everything. I saw this used in the NICU. So in the NICU, they do have a larger NICU. It really just depends on the season, if there's like RSV or if there's a lot of preemies. Normally the ratio is like a 2-to-1, 3-to-1. So the nurse is responsible for all the care for that baby. And that's a little bit more manageable I'm not saying only have 2 patients, because you never know what's going on with those 2 patients, but it's a little bit more manageable when there are 2 patients. Team nursing system is when an RN leads and coordinates care to other members of the team, such as the LPNs or the CNAs. If done correctly, this really does help the staff. This is a big nursing system that you see in like a unit like telemetry. The nurse ratio there, depending on the day, could be like a 4-to-1, 5-to-1, hopefully not a 6-to-1, but it could happen. Using this model, the whole team's working together. You could have a telemetry tech come out to the nurse and say, hey, I know you're really busy, but can you please go check on room 5? I don't know if his leads are off or if something's going on, but can you just go check on him? This is something that might have gone unnoticed if the nurse was doing total patient care, just all by herself on this unit. So I think that was really helpful doing on the telemetry unit. I did talk a little bit about to the nurses about like their appraisals and things like that. They have them done every 6 months. They usually meet with their director of nursing or a supervisor. They talk about how everything's going. If doing well, they could get a raise, they could get a bonus. I really enjoyed talking to all the nurses at Princeton. They said that the hospital is a great teaching hospital, which I absolutely love. They make it fun. They do family days, they do celebration days where you can go out with your coworkers and their families outside of the office, whether it be at a camp or like a Liberty Lake or something like that, and they just do a lot of family things together because they feel like a family, and morale is very, very high at Princeton. Princeton is committed to maintaining national patient safety goals established by JCAHO, the Joint Commission. Princeton was named one of the nation's top performers for the 3rd year straight on key quality measures. Princeton is one of only 182 hospitals in the United States that has earned this recognition at least 3 years in a row. The 2 goals that this hospital was mostly working on was patient identification and infection control. So for patient identification, Princeton does do a check 2 before you do motto. So they always ask a patient your name and your date of birth, and they check it against the hospital record. Even if they've seen the patient 500 times that day, they've had the patient for a week, they're always going in just to keep themselves accountable and the patients accountable. Princeton also has an infectious control team comprised of trained nurses and a physician. The team does surveillance, prevention, monitoring of infectious diseases in the hospital. The biggest way that everyone is working towards this safety goal is hand washing. Princeton has alcohol-based hand gel available throughout the hospital for the staff and the visitors to use. They also have gloves, mask, eye protection, gowns, anything depending on what the patient has. Before 2018, I touched on this, Princeton was mostly run off of donations. They would really help anyone. They still do help anyone, but they would just hope that their donors were seeing that and would give them the money back. Now that a big name like Penn Medical has taken over, they don't have as many money problems. They're well equipped with technology, many renovations, lots of changes going on there. So before teaming up with Penn Medicine, Princeton was a very small hospital. Not many people talked about it, and that was its biggest weakness because it was just called Princeton Hospital. So not a lot of people would want to go there when you could go 5 miles down the road another way and go to Robert Wood Johnson, and that's a big one in our area. So that was its weakness. However, teaming with Penn Medicine, creating all these renovations, creating a brand name, really, business has been booming. You can do inpatient care, outpatient care. You can go to one facility, have x-rays, blood work, see your cardiologist, and go to the gym in just one trip. So that is a strength, one of their biggest strengths that they have done over the last year. Princeton does many strategies to recruit and keep their staff members. One of the things here is that you're supposed to have your bachelor's degree in nursing to work in a hospital by 2020. A lot of hospitals in our area will not hire you unless you have a bachelor's degree. They refuse. So it's very hard for someone that just has an RN to get a job in a hospital. One of the things that Princeton does is they will hire you with just your RN. They give you 5 years to get your bachelor's, and they give you tuition assistance. If for some reason in those 5 years you don't get your degree, you're expected to pay all that money back. So I think that's a huge motivator to try and get your bachelor's in those 5 years. They also do like friendly competitions between floors. They'll decorate for Halloween. It's like a motivation strategy just to keep work fun. I absolutely loved my time at Princeton. I had a great time with Dolores Vandergriff. She was absolutely amazing. Everyone was super welcoming. Morale was very high. Everyone enjoyed coming to work. I really think that one day I would love to apply there, especially having a bachelor's soon. They said they would give me a stipend or a bonus just for, having my bachelor's degree. I did just want to show you guys a little visual aid. So they did just update the outside. So now Princeton looks like this. I know you guys, I'm trying to show you guys. So it's like really state of the art. If you go to any kind of outpatient service, this is the one I got from maternal medicine. So they give you one of these binders, and then on the inside, they just give you a lot of information based on what you're coming for. So maternal fetal medicine just gave me this one. They give you a bunch of books like planning your pregnancy, you and your body, how to track pregnancy. So it really is great. Princeton does a great job, and this was a great experience. So thank you guys so much.